We can get started. Um, Good afternoon, everyone. Welcome to the Supportive Housing Network of New York's Service Program for Older People NetWorkshop. Feel free to put any questions you have in the chat, in the Q&A. Sorry, if you have any questions, put them in the Q&A. If you can say hello in the chat as well. We're joined by Caitlin Downing, Assistant Director of Social Health. Caitlin, I'm going to turn it over to you.
Thanks so much. I'm so happy to be here. Give me one second. Okay. Okay. So hello, everyone. I'm so happy to be here. I'm Caitlin Downing. I'm the Assistant Director of Social Health at Service Program for Older People. Um, I was really excited to have the opportunity of introducing SPOP to Shinny because long ago I worked in supportive housing, so I've been to my share of Shinny conferences, and I'm really hopeful that what SPOP has to offer might be useful to some of the folks that are in your programs. So I'm just going to cover an overview of our programs and services, and I'll do my best to answer any questions that you have as things come up. So a little bit about SPOP. We are service program for older people. We are based here in New York City. We're one of the first agencies in the United States that's devoted to meeting the behavioral health needs of older adults. And for us, for SPOPs, older adults are anyone 55 and older. Our mission is to enhance the quality of life of older adults and to foster their independent living through the delivery of comprehensive mental health and supportive services, advocacy, and education. And we're actually one of the only organizations in all of New York State that is exclusively dedicated to community-based mental health care for older adults. So, as an organization, we have a lot of values. Integrity, dignity, and respect are a few of them. We really value the dignity of older adults. We want to honor voice and choice, and we hold ourselves to a really high standard in our work. Um, and I have a colleague who says we really swing for the fences with our vision statement, which is that we envision a world that values older adults and ensures age-affirming behavioral health care for all. So today I'll talk a little bit about SPOP services, our clinic, our PROS program, our bereavement groups, our social health program, which is called Strive, and our advocacy and education department. So all of these services are available to adults 55 and older. All of our clinicians are licensed in New York, so folks have to be in New York State and for the most part, New York City to get services from SPOP. Our clinic supports the mental health of older adults. I don't know if this number is totally accurate. I think this is a little low, but I think our clinic is currently serving over 650 older adults. We offer individual psychotherapy, clinical groups, psychiatric treatment, medication management, and all of our providers, we have licensed clinical social workers, psychiatrists, psychiatric nurse practitioners. All of our providers are trained in and have a lot of experience working specifically with older adults. And our providers themselves have different areas of specialization and specialties. So we try to match folks who are coming to us for treatment with a therapist who's really experienced in exactly what that person is looking for in terms of treatment. Um, Through our clinic, we can also offer appointments called principal illness navigation, and those are Medicare funded social work appointments to help people address the concrete needs that they might have trouble accessing because of symptoms of mental health. So if someone's experiencing symptoms of depression that are making it harder for them to, get their health insurance renewed or apply for SNAP benefits, we can offer this uh, principal illness navigation appointment through our clinic. And our clinic services are offered in person. We see people at our clinic on the Upper West Side. We're on West 91st and West End Avenue. We also do a lot of telehealth. Our folks really kind of moved to virtual services during COVID, and it's a lot of people's preference now that we have more in-person availability. We're still noticing that for many people, their preference is still to meet their therapist over Zoom. So we still have that available. We also have many satellite locations in New York City. We've got clinicians, so therapists that are working in, oftentimes they're embedded in older adult centers. So 1 or 2 days a week, people can go and get their therapy appointment in the community, closer to home where they live. And so we've got satellite clinics. I think there are 20 in the Bronx. There's one in the Bronx. There's 1 or 2 in Brooklyn, and then all over Manhattan. Okay. Our PROS program. PROS stands for Personalized Recovery Oriented Services. PROS is a Medicaid-funded program that offers recovery-oriented, person-centered, strengths-based groups. So, our SPOPs PROS program is really unique because it's the only PROS program that is dedicated to serving only older adults. All PROS programs serve adults. Most of them are 18 and older, but ours is just for adults 55 and older. SPOPs PROS program, we've got groups that are offered 5 days a week in a combination of in-person, um, Zoom, or a hybrid. So some of our groups are offered in person, and then they have a big smart board so people can join remotely from home if they prefer. And our participants choose to attend groups that relate to their specific recovery goals. So there's skills training and wellness groups that, depending on a person's goal, they can choose to participate in. So if someone has a goal to, like an employment goal, they might choose to participate in like an anger management group because that might help with skill building around these interpersonal relationships. That folks might expect to encounter in their employment. PROS has this wonderful interdisciplinary team. So we have social workers, recovery counselors, peers. We have LCATs, licensed creative arts therapists. We have a drama therapist. So the groups are very dynamic and they change on cycles depending on what the community is looking for, what the goals of many of our participants have. And so those change based on a different cycle, and it's all up to our participants which groups make the most sense for them. We offer individual case assistance in this program, and our our providers, our psychiatric providers, work both in our clinic and in our PROS program. So PROS participants can also see the psychiatrist or the psychiatric nurse practitioner. They can have medication management. They can get some support for that at our PROS program in person as well. And I'll say for this program in particular, it's a really tight-knit, incredible community. So we have people that are with us 5 days a week. Tuesdays, Wednesdays, Thursdays, our programs are on site. They're in person. We have lunch, and folks just really get together and support each other and share meals, really get to know each other well. We have some folks that come with us for years. And that program is Medicaid funded, so people have to have Medicaid to participate in PROS. SPOP also has a bereavement program. We have, and so these are groups that are designed to support folks who have experienced the death of a loved one. SPOP runs spousal bereavement groups and also non-spousal bereavement groups. And all of our bereavement groups are currently offered virtually over Zoom. They are they are no cost to our participants, so they're free of charge. And these groups also operate on cycles. So if you're interested in learning more, I have information for our intake department. So if you or someone would be interested in our bereavement programs, you can just call our intake department and they can give you information about upcoming programs and schedules. Okay, Strive. Strive is our social health program. Folks that are enrolled in the SPOP clinic can participate, and also folks that are not enrolled in the SPOP clinic can participate in our Strive program. Strive is funded through a grant from New York State, the Office of Mental Health, and it's a triple partnership. SPOP, we are the mental health service provider on the partnership. Metropolitan Center for Mental Health Families and Individuals in Recovery program, their FAIR program. They are our substance use treatment provider partners. And then we're also connected with NYC Aging, which helps us get folks connected with a huge range of supports and services. The Strive program offers short-term case assistance. It's usually about 6 months or less, and we provide linkages to long-term supports. We refer people to, uh, any kind of service or community-based resource or benefit that might help address a concrete need for people. So, things like transportation, housing applications, food resources. A lot of folks need legal referrals or they're facing eviction, rental arrears. I've had some folks who needed help taking care of a pet because they were recovering from surgery, medical escorting to appointments. You name it, we try to figure out what is out there that's available that can help meet these social health needs. Because as you all know, these social health needs can impact our physical health and our mental health as well. And so helping to reduce, someone's stress because they're facing eviction, helping to reduce someone feeling overburdened by their role as a caregiver, all of these things are incredibly important alongside the treatment people are getting with their therapist. And so we're able to offer that through our Strive grant. Because it's grant funded, all of these services are also free of charge to participants. We can offer Strive services through in-person appointments, telehealth, phone, audio only. We meet people in the community. Strive can do home visits. And Strive can also help with technology skill building so that, if someone would like to participate in some community resource, but they're not able to access it for technology, Strive can step in and provide some tech skill building, get people set up on Zoom. Strive also offers this weekly support circle in person at our clinic that's free because a lot of folks have let us know, especially coming out of, the COVID pandemic, people are facing, just feeling extremely socially isolated. So we have this weekly support circle as well that's facilitated by our community support social worker. And Strive also tries to help people identify things that they would like to do, things that are fun to do, things that are, joyful. Because we find that many people come to us because they're constantly trying to navigate these like enormous crises one after another in their lives. And folks don't often give themselves permission to do things that are fun for them, that are not just in service of meeting these concrete needs. Anyway, so that's Strive. Um, and SPOP also has a training and education department. We offer most of our trainings and education are fee-based. So, we have staff that develop these trainings. We are accredited by New York State, so we can offer continuing education units for social workers. And we often provide trainings for service providers and for social workers and for organizations who want to learn more about specifics around, like, are there differences in how you provide services to older adults? What are some of the specific needs to older adults that we can help address? How can we be more age affirming in our work? So SPOP kind of tries to lend its experience and lend our knowledge and provide some support to different healthcare providers, different organizations who are working with older adults. So like I said, usually our trainings are fee-based. However, SPOP does occasionally get grants to provide free trainings. So I'm sure, if you're interested, I'm sure there's a way to plug you in if we have a mailing list or something like that, so that if those things are offered in the future, we can make sure people know about them. We also offer workshops for older adults out in the community. They cover a variety of topics depending on what people need. We do community outreach. Sometimes we'll go to local libraries to talk about mental health and older adulthood. Around this time of year, it often is, helping folks notice signs of seasonal affective disorder, like seasonal depression, when to ask for help, when are the winter blues not just a passing phase, when it would make sense for people to come in and see someone and talk about things. So we do that as well. Um, Now I'll just tell you a little bit about, obviously this is so specific to individual folks. We take referrals, people refer themselves. Sometimes people might refer a friend. Sometimes people call us to refer a parent or a sister. Um, we get referrals from hospitals, from social workers in the community, from all kinds of different, there's all kinds of different referral sources. Um, we have, this is just like a bare bones kind of intake and eligibility things I want to flag for you all. Because of the regulations around billing for like Medicare, Medicaid in a mental health clinic, there is an either in-person or visual component to at least one appointment per year. Usually that's the annual psychiatric evaluation. So that being said, like a client at SPOP would have to be able to complete at least some part of their initial intake, either in person or by Zoom. We don't offer home visits as part of our intake. And so if somebody is not able to leave their home, they have mobility concerns, we would really work hard to get them set up on Zoom so that they could move forward with intake because we have to be able to see folks. We don't, audio only treatment is very rare at SPOP. And PROS itself requires clients to engage at least in person at least some of the time because it's so important for that community that people connect. So PROS has some in-person requirements. Our clinic requires either some in person or Zoom, at least, during our intake. And then there's an annual psychiatric evaluation that would require some visual component. And so SPOP takes insurance. I mentioned like some of our programs are funded through grants or are, volunteer based, like our bereavement program. So there are some services that are offered for free, which is really wonderful. We're so happy to be able to do that. And then for our individual therapy, for our group therapy, for our PROS program, we take all kinds of insurance. So PROS requires Medicaid. For a lot of our folks, that means they're dual eligible, so they have Medicare and Medicaid. And then for our clinic, we take Medicare, we take Medicaid, we take a lot of private insurance plans. Like many of our clients are working, and so they have coverage through their employers. Um, and there are so many different plans and nuances to that. So I will just say, if you have questions about in-network coverage, or if you have a client who has a question about in-network coverage, you can just call our intake department and they can check folks' insurance and see, if there's a copay, if there are, what the requirements are for behavioral health coverage for somebody's individual plan. Oh, that's it. That's everything. So, we have, I put a couple things here. So, for our clinic services, we have just a main intake phone number, and that can cover any kind of referral or connection for any of our programs. We have a department that's our like access department. And so this 600 extension is our intake department. That's kind of where folks can get in touch with us to make a referral either for themselves or for somebody else for our clinical services. And our email address for our general intake department is just intake@spop.org. Providers can also submit referrals through our website at www.spop.org. And then if you have questions for our training and education department, you can click on a button on our website that will send an email directly to our training department. Um, and that's it. That's sort of like the elevator pitch for SPOP, older adults 55 and older. If you have anyone who you think might benefit, which like who couldn't, anyone who you think might benefit from support for mental health and wellness, we hope you'll think of us. I imagine it might make sense for a lot of folks that are living in supportive housing in the city. So that's it. I don't know. Let me see if I'm able to see any questions. Hang on a moment. Oh, okay. Oh, I can. Great. Okay, I see there's a question about Rockland County. Um, I think it is possible to see folks through telehealth for Rockland County. I'm happy to confirm and get back to you, but I think our providers are able to see anyone in the state because that's how, the social work licenses kind of cover. Okay. I see a question about the age requirements. Our age requirements are just 55 and up. So we see folks that are 55, we see people that are well into their 90s. And yes, I see that someone has a resident who only speaks Spanish. That's a really, really, really good question. So we have providers that can see folks in English and Spanish. There might be a handful of other languages that can be covered, but for sure English and for sure Spanish, yes. Um, is Strive at the satellite locations or only the main location? So that's a really good question. Clients for any of our sites, whether it's our clinic or they see us just over Zoom or they've got their therapy in Brooklyn, anyone is eligible to participate in Strive. The staff people who deliver the Strive services are physically located at the clinic, but they are very mobile, so they can travel anywhere in the community. They can meet people over telehealth. They do a lot over phone with like conference calls and things like that. Um, can a client have SPOP services and an IMT team, or is that dual services? That's a really good question. I don't know the answer, but I'm happy to get back to you if you'd like, or I can reach back out to Shini and send some answers. Um, who is the contact if you're interested in more information on provider trainings? Her name is Allie Webb. She's AWEBB at spop.org. And our spop.org website also has a button in our training and education, um, I don't know, page. And it'll have like a little field you can fill out if you have more questions. Okay. Can SPOP do in-person presentations? Yes, we can. In fact, Allie Webb, who I just mentioned, she had a grant to provide some services, some like trainings to folks in all over New York State, and she was in like Poughkeepsie on Monday. So yes, locations in the Bronx, yes, we do. There is a Sage satellite clinic that is in the Bronx. That's the one that comes to mind. There might be another one, but there's a Sage supportive housing in the Bronx that has a SPOP satellite. So there's a clinician that works out of there. Um, yes. Oh, you're welcome. I see a Wishfish. Yes, lovely. We have a satellite provider at a Wishfish location at the Red Oak Older Adult Center. So some of you might know some spoppers at your sites. We do have a therapist who works out of Red Oak. Um, yes, Allison, I see you. And I'm writing down your number and your email address. Okay. Um, do referrals need to come through an agency? No, not at all. In fact, most of our referrals are people calling for themselves. People call because they're having a hard time. We sometimes have folks who call because they have had a recent diagnosis of a chronic illness. They're having a really hard time processing it. People are feeling really sad and depressed and alone and anxious and yeah, so people call us all the time just to come get therapy. Do services from SPOP continue or do folks graduate? That's a really good question. It really depends on the individual. Some folks are with us for a long time, and some people come episodically. Some folks come for, kind of an episode of treatment at SPOP where they might be struggling with a particularly difficult period of depression, and then when they're feeling better, they might choose to end their weekly therapy sessions and then kind of come back to us if they have another life event. And then we have folks that come that are with us for years, and see their therapist every week for years and years. It's a big range. And our pros program folks do sometimes have a graduation where they've met their goals and they're participating more in the community, and then they kind of leave the pros program. So that also happens. Um, I see another question about the specific satellites in the Bronx. That one is, I know there's one at Sage. I can get a list to maybe to try and get out to everybody of where the satellites are, if that would be helpful. Yeah, yes. You can reach out to Allie. The best way probably would be through the spop.org. There's a SPOP, there's a training and education page, and there's a button for inquiries, and that goes right to her. So you can submit that and she will get back to you. Can SPOP do substance use treatment? That's a great question. SPOP, so many of our clients use substances. Lots of folks are using alcohol, and that's something that they're coming to us for treatment with, things like that. We also do kind of dual enroll people, for example, through Strive, we have a partnership with MCMH's FAIR program. So sometimes folks come to SPOP for some type of clinical treatment, and then they also enroll at FAIR or another treatment provider to do more substance use treatment. So I don't have a direct answer to your question besides to say it depends on the individual, it depends on what they're in need of, and it depends on what their like primary diagnosis is and what they're looking for in terms of support. So if they're looking for like medication assisted treatment, we probably would try to get them connected with Metropolitan Fair or something like that, something that might be better suited for them. But whenever folks call us and they do their initial eligibility call with our intake department, we do some screenings and like kind of like quick screens with them to make sure that folks are appropriate for treatment at SPOP. And if they aren't, or if we feel like and our clients and the people calling feel like they might be a better fit for another type of provider, then we do our best to get people connected. Um, an in-house presentation. Yeah, I mean, like a presentation on services or trainings or anything like that. Yeah, I mean, you're welcome to reach out to us, and we can have conversation and see what we can do. Okay. Okay, I'm at the end of the Q&A list. I think maybe not. Oh, transportation provided. This is a great question as well because that's a huge barrier for a lot of our folks. Sometimes, or it can be. Well, what I would say is if people have Medicaid, they might be eligible to have Medicaid transportation for services. For a lot of people in our PROS program, they use Medicaid transportation. So they have rides that kind of drop them off and then pick them up at the end of the day to bring folks home. For folks who have Medicare, there might be some coverage. They might have a certain number of non-emergency transportations through their health insurance that can cover transportation. And then if transportation is a barrier for folks being able to access our services, they can work with somebody in our Strive program to figure out what their transportation options are. So that's kind of a long-winded way of saying that SPOP, we don't provide transportation. And also, we will try to help people identify what transportation benefits they might be eligible so that transportation or lack of it wouldn't prohibit them from getting mental health treatment. I don't see any more questions. I don't know if that means there aren't any, or if I've done such a great job explaining our services.
I think if anyone doesn't have any more questions, again, thank you, Caitlin, so much. We will share the slides and any other resources that Caitlin has for us.
Yeah, happy to.
Oh, I think there might be. Okay, there's just people saying thank you in the
Oh,
Q&A.
you're so welcome. I really, really hope you all think of us, if you have older adults who you think could benefit from some mental health support. We love what we do and we love all of the folks that come to us and yeah, we're here. We're here if you'll need us.
Thank you so much. Everyone, have a good day.
Bye, thank you.